My profession is a high school math teacher.
And business agency consultant.
A stay-at-home mom.
In my free time, I like to do photography.
I am the world's greatest housewife.
I teach 7th and 8th grade special education.
So when I found out I had breast cancer, I was shocked, first of all. I don't know why, because I know that it's like 1 in 8 women, I think, is the current statistic.
One night I was getting ready for bed. I realized that there was some fluid coming out of my right breast, and realized that I also had a lump there as well.
I found out I had breast cancer in May of 2016. I have a huge family history of breast cancer.
I found out I was BRCA positive a few years ago after my dad's 2 sisters had both had breast cancer and been diagnosed.
My mom was diagnosed with breast cancer at age 34. I had my own genetic testing done. I was 24 and I found out that I did carry that gene, so I was positive for the BRCA mutation.
My 2 older sisters, before the age of 40, they were both diagnosed with breast cancer. I had the gene testing and it came back. It wasn't the BRCA gene, it was the CHEK gene. Both of my sisters were very adamant on me doing the right thing for me.
So a common question that plastic surgeons get when meeting with a woman who is going to be having a mastectomy is, what are my options for breast reconstruction? And one of the great things about plastic surgery today is that there are many options for breast reconstruction. Some might be an implant-only reconstruction for women who aren't comfortable with that or maybe not candidates for that. We might use living tissue from somewhere else in their body, most commonly the abdomen. And then occasionally the option that works best is a combination of living tissue along with an implant, whether it's small or large, depending on that person's medical condition, the requirements in terms of any other treatment that she needs to treat the cancer, and her overall health. And so really we don't want to have the idea that there's a best option. It's what's the best option for that individual patient.
It's important that it's a conversation between the patient, the woman with breast cancer, and the plastic surgeon to get to, all right, these are all of your options. These are the benefits of this option, the downsides of this option. And then, the women know their body their best, so they can tell you, all right, I think this is what I want to do because it provides me the best reconstruction I can get and fits into my life right now with what's going on.
I chose the deep flap partly because I wanted it more natural.
I chose the implant-based reconstruction, and I'm really happy with it.
I chose the deep flap after hearing all my options at the consultation. Plus, they offered something that I would never have considered on my own, but when you do the deep with the flap, then it actually gives you a tummy tuck in the process. And I was like, well, I would never do this on my own, but hey, that's a nice, plus to a bad situation.
We had discussed, just doing fat grafting or implant-based. I didn't have enough fat from my abdomen to be able to place to make it look like I did before surgery. And so we opted for the implant reconstruction.
Women joke around all the time about, hey, wouldn't it be great if we could take fat from our butt and put it in our boobs, right? But I didn't know that it was really something that could be done. I asked him, I said, is there a surgery where we can use my own tissue? And he said, oh yeah, I was just gonna get into that. He goes, not a lot of people ask about it. And so when he said, yeah, I happen to be somebody that does that surgery, I was thrilled.
Before I came to see Dr. Rinard, I chose the deep flap surgery. However, when I came in, he told me that I didn't have enough tissue, didn't have enough fat to do that surgery, so I got the implants.
When I was in medical school, my dad passed away from cancer, and I always wanted to be a plastic surgeon, and it really bugged me that maybe I wouldn't be able to be a plastic surgeon and do as much with cancer. So as I progressed through my surgical training, I really learned how much I can do for cancer. It made me comfortable still being a plastic surgeon. So it's very, very important to me to be able to offer all of those options. One of the things that I really like when I meet a patient that's going through the most difficult time of their lives is to tell them, don't worry about your outcome, don't worry about your appearance. That's my job to worry about. You just focus on getting better and I'll worry about all the other stuff.
I have absolutely loved the results that I've received. To have something taken away from you that you don't choose to have taken away from you, and really understanding that for a woman, it really is part of who we are. You know, when we look in the mirror, that encompasses a lot of how we feel about ourselves, in terms of making me feel like a woman again, like a human being.
I am happy with the outcome. At first, when I was finished with everything, I was a little lost, because now what do? Then you realize I can do anything. I can do everything. I'm trying to push my endurance. I've started boxing. I don't get in the ring and spar with people, but I really like it, because all these surgeries and everything can leave you feeling very fragile. That is one thing I told myself. I cannot succumb to the fragility of the whole situation. I cannot come to that, because I'm 52. And 52, it can't be old anymore. It used to be, but for me, it can't be old anymore. But I'm happy with my reconstruction. I'm happy with my life. And I'm more grateful I get to live my life.
The outcome has been better than we imagined. Doctors that have seen it before and after, such as my primary care and those kind of doctors, I've had one even comment, "You can't even tell you had anything done," which is pretty impressive considering everything that has been done with a double mastectomy and reconstruction. We are extremely happy with the outcome.
It was even better than what I could have imagined. Obviously, you don't know how things are going to go having a surgery. I was very pleased with my results, how I felt, how I looked, and exceeded my expectations. I was very happy with Intermountain Healthcare.
The outcome of the surgery has been amazing. The day I went back to work, I felt great. Everyone at work said that I looked great, and it's been amazing.
It all worked out a lot better than I had imagined, and I had a lot of support from others, and I was able to get back into my life and my business a lot quicker than I had imagined. Overall, I still feel like a woman. No one notices. Like when you meet me, you wouldn't notice and realize that I'd had these procedures done. So overall, I really don't feel different. I'm still me, still a woman, still how I was meant to be.
I am completely thrilled with the outcome of my surgery. I feel like I didn't lose anything. It's like the day I walked in. There was no surprises. It was very much what they had told me it would be, and actually exceeded my expectations. I don't know, he worked some magic in there, and he made them pretty perfect.